Today I'm going to talk about influenza vaccination. I got a request or a question that someone who is a healthy 50-year-old if they benefit from the flu vaccine. The answer is yes, they do. Flu is a viral infection. It's a specific viral infection caused by either influenza A or influenza B, and it has this seasonality that we're all familiar with in temperate climates like the United States, like Canada, where in our winter, colder months, the virus circulates. It doesn't go completely away in summer, but it's at a very low level. And the flu vaccine, a couple things that are important to know about it. It's not necessarily designed to prevent you from getting the flu. It's more about preventing complications from the flu. It's about making your flu less severe so that you have to take less time off of work. And certainly for the high risk, which includes the very young, the very old, pregnant women, other people with high risk conditions, it keeps them out of the hospital and it keeps them alive. In fact, if you look at pediatric deaths from influenza, they are invariably in unvaccinated individuals. But the flu vaccine isn't our best vaccine. As I said, it doesn't really stop the flu that great. Sometimes it does, sometimes it doesn't. And that's because they have to pick the strains to put into it. There are 3 strains that are in our flu vaccines, and those have to be picked pretty well ahead of time before the season in order to make sure that the vaccines are ready when fall hits. And that can lead to mismatches. And sometimes it can be a pretty bad mismatch. And some years it's pretty good. But even when it's mismatched, the vaccine's ability to prevent against hospitalization, emergency department visits is pretty good. And it does give you some protection for the duration of the flu season. Now, the duration of the flu season is important because sometimes you see advertisements for flu vaccines in August. That's too early to get the flu vaccine because it will wear off by the end of the season. And remember, the season typically peaks around February. So I tell people to get the vaccine by the end of October. Actually, I got mine earlier this week. There's a whole bunch of different flu vaccines, and I just want to cover a few things about them. If you're above the age of 65, you should be getting a flu high-dose vaccine or one that is adjuvanted, which has an extra molecule in it that boosts your immune response because the elderly don't respond very well to flu vaccines. So we have special vaccines for the elderly. The other thing is that flu vaccines are primarily still made in eggs, which is a very slow, cumbersome process, which requires you to pick the strains way ahead of time and also leads to the strain becoming adapted to eggs and not being as effective. So I really advocate people to get the cell-based vaccines like Flucelvax and Flublok, which are made in cell lines. I get Flublok every year. That's I think, the best type of vaccine. And then we also have FluMist, which is a nasal spray vaccine that younger people can get. And you can actually get that mail order now. You can self-administer it, which is another innovative way to giving that. So we've got a lot of flu vaccines out there. I think people should go get their flu vaccine today before the month is over and before the flu season starts in earnest.